the Deputy Health Minister, Dr. Sibongiseni Dlomo, together with the Gauteng and Northwest Health MECs. They'll today observe World Diabetes Day. This will be done through an interprovincial cycling challenge between the two provinces. Newzroom Afrika's Zola Sholwana following that event for us. Zola, good morning to you. You'll tell us exactly where you are, but again, an important awareness campaign reminding South Africans of the dangers of diabetes. What's the central message this year?
Well, today's event, Oli, is mostly about prevention rather than cure. There's quite a number of mobile clinics here to offer services to residents of Carltonville in Gauteng township to basically say to those that don't know where they stand, they are actually encouraged in this event to, go and run tests. It's not only diabetes, there's only, HIV and AIDS and also male circumcision. And I'm joined by the Deputy Minister of Health, Mr. Dr. Dlomo. So thank you very much for your time. I mean, we can see that you're also ready, for cycling, and we are told that there will be over 100 cyclists that will take part in today's event. And today is really about commemorating World Diabetes Day.
Exactly. So thank you very much for this opportunity. We have just been warmly welcomed by the mayor of this place, Marafong Municipality, the one who's just standing on my right, Councillor Best, and we have had a briefing of this 3-in-1. As we are having this interview with you, we are delaying our start. We are ready to go and start cycling. Of course, you could cycle as much as you can. Some of us will not do the full 40-kilometer cycling. On my left is an MEC for health in Gauteng, and our MEC for health in Northwest is still sorting out his bicycle. We are all so excited about having this activity, and we are correct, about 100 cyclists have joined us, some of them much more professional than us, and we are just saying this is a good day because there's a slogan that says, know your status, reduce the risk. If we could know today, if someone were to screen me, check me and tell me I'm diabetic, then I must start the treatment and then I'm going to be able to be controlled. Diabetes is the second killer of our population in the country. So we are celebrating this day, but bringing awareness. Later on, there's going to be aerobics and also going to be a walk for some of our citizens. It's the 14th of November in the world is taken as a diabetes day, but we, as these two provinces are together, we are highlighting it much broader and to say, can we have a situation where it is not just one day, but an awareness for all of us? So we are very delighted to have these very key leaders, the municipality, the MECs of two provinces, and I'm here sent by the minister to really champion and push that we really make sure we bring an awareness. Know your status, you will reduce the risk.
You spoke about knowing your status, and I'm seeing a number of mobile clinics that are offering different services like testing for HIV and AIDS and also male circumcision. Are we expecting more people, residents rather, that are actually coming to make use of those services?
Even though today we are focusing on diabetes, but we don't always say, when we have such events, we say as a government, our people will be coming in there to know whether they have any issues about TB, HIV, hypertension, cancer. So we have the whole host of other screening services here that are going to be here with us the whole day long. It's very routine each time we have an event of health to bring such services there. You might probably pick up there maybe some other departments joining us, Home Affairs for people who want to actually register and get their IDs so we really provide as a government, because it's not always that we are here all the time, but when you do come in, we bring all services, particularly those of health, for our citizens to really access.
Thank you very much. Let me come to you, MEC. I can see that you're ready to join. The minister told me that he'll actually be cycling. What will you be doing in today's event?
In fact, I want to cycle, but it won't be too much because I've not been cycling. And I'm laughing because I used to be so scared of a bicycle. But now, because I have to do this, and you can see that everybody is geared up for the event, And in fact, what we've been doing in the province, even besides this, is to do promotion on our non-communicable diseases. And part of those has been diabetes, because for me it's very close to my heart, because my father was diabetic, my brother was diabetic. I have two brothers, both were diabetic, so it's in the family for me. And I always encourage people that it's about preventing the diseases. But if you are aware that now you are diabetic, it's to make sure that you maintain the status, but you continuously check yourself, you stick to your medication. But now as a province, through the message from national is that let's always prevent than to allow people to have these diseases. And I'm sure you have seen the work that we've been doing in the province through promotion, health promotion programs that we are doing. This is part of that health promotion program that we are doing. And I'm sure you have asked yourself, why Mirafong this time around in the outskirts of Mirafong, in the border of Northwest? We wanted to have this in areas where we have not been able to reach out with the Department of Health and with the provinces. Both are combining both provinces. And for us is to send a message that on health issues we are together. We send one message, no conflicting messages. We're promoting awareness. We want everybody to be healthy, because if we are promoting wellness, nobody will go to the clinic or to the hospital, because everybody will understand what must they do to prevent the diseases. Because it's not only about diabetics. Once you start doing some walking, cycling, eating healthy, checking your status, there are a lot of things that we are preventing.
Thank you very much for your time, MEC. Now, Xoli, the MEC also mentioned that today really is about promoting, or rather telling residents about the importance of physical activity in terms of preventing such diseases. We have seen the young and the old, especially the old, in today's event that will be taking part of today's activities. We'll be back to you with more updates later on. Back to you in studio.
Zola, Sholwana, thank you very much. A very important wellness campaign there, spearheaded by the Deputy Minister of Health.